versus who. And now we're being recorded. Good call on waiting a second on that. So why don't we go around the in-person room first?
Okay, I'll start, even though I'm kind of in the middle. I'm Stacy Triplett, the Engagement Director for AARP Oregon, and member of this committee.
Nadia Mohammed. I am the Advisory Bodies Coordinator for the Homeless Services Division of the Department of Housing in Washington County.
Valentina Barrett, she, her pronouns, and I'm a Community Engagement Program Coordinator, and I've joined remotely and also was here at the first meeting, so some of you may remember me the first one, but I'm Nadia's counterpart on the shelter opening and engagement side of things.
Okay.
So when new access centers, shelters, and other facilities open, I help support the CERT team strategic initiatives and relations in creating those relationships and building a neighborhood plan.
So Trinard May, I'm the new, as in 3.5 days ago, equity coordinator for homeless services.
Thanks, Mark. I'm excited to have Sharad. Don't scare him away.
What do I say? What do I say?
Hey folks, Nicole Singh, she, her pronouns, Strategic Initiatives and Relations Manager in the Homeless Services Division.
Leo, soy la Copiano, Housing and Stability Director for Community Action. And
In a corner.
In the corner, Meredith Cook, Administrative Specialist with Homeless Services. Passed online.
Kim Marshall with Project Homeless Connect.
Lisa Klondike, I'm the Community Connect Program Coordinator, and I'm presenting today for Washington County.
Hi, everybody. I'm Carly Brandini, Quality Improvement Program Coordinator with Washington County.
We see you trying, Jim. You're still muted.
Right, like, what am I gonna do?
Oh, there we go. Oh, how about that? Hi, Jim Bain, community member and Metro Council member.
I'm a musician, apparently. I love all those guitars.
Right, so I think that's everybody that's currently here. We'll see if a few more people jump online. Our first agenda item is public comment. Is there anybody in the room or online that would like to make some comments?
We have one person online. We'll see if there's a comment in the chat.
I'm not seeing anything in the chat, Meredith.
Nope, nothing's posted yet, so.
Oh.
I will let you know if the comment shows up.
So is that no public comment?
Yeah, I think we can move on.
Perfect. Okay, our next agenda item is a subcommittee updates. The first one is the performance evaluation technical subcommittee.
Hello. So we met July 10 and we reviewed the continuum of care 23-24 racial equity data and the supporting housing service data as well that I think we all had a chance to see. We also reviewed the different points of the LC3 process to evaluate system performance and also have knowledge of how that works. The committee will review each stage of the process, the life cycle each month, and we know that we have like the average part of the system, the access part of the system, the coordinated entry phases, the referral, program enrollment, housing placement, retention, and graduation for those successful house. And see, you know, we bring up a lot of questions of how we can improve every part of the systems, and what are the goals that we would like to see, what is working, what is not working, and just kind of like analyze for a better system dynamic of all of these points. And what else? We will also would like to look at the coordinated entry program enrollment, especially those cases that are being declined and the folks that are becoming inactive as well. Again, analyze every part of the system that is probably, you know, stuck, and see how can we improve it and make it more efficient and effective for those waiting there. We will do that. That's it.
Great. Awesome, wonderful, thank you. And then I believe Nadia, you were gonna do the Lived Experience Advisory Committee update?
Yes, yeah, Hannah couldn't make it today. So we had our first lived experience subcommittee meeting. We had about 6 participants. Most of them were folks who had past lived experience with homelessness and are now actually working in the field. And then we had one participant who's currently in the system and had more recent experience. And we, I think overall, it was a good first introduction to this space. I think we're still looking to diversify the voices that came to the table, not just in terms of like ethnicity or gender or those kinds of things, but also in terms of life experience. So one of the things I noticed is all the folks who spoke to us were folks who had gone through this experience as like a single person versus like maybe someone who had a family or children or other, you know, folks that they were responsible for. So there's a great like variety of voices that are that we still have not found. So we will continue recruiting, and I'm also considering how we can reformat some of these discussions. So maybe they're like smaller group discussions instead of larger groups where we can then get more detail from people and more feedback. I think one main takeaway that came from just about everybody was the need for greater support services for folks who, like, once they achieve housing, they, from their own experience, felt like inept in being able to take care of themselves, to be able to maintain housing and those kinds of things. And they either really struggled if they didn't have support services that could like help them with building those skills and just like someone being there for them, or they really thrived because they had someone, maybe as a case manager or counselor or somebody who really stood by them and helped them succeed in that way.
Great update. Thank you so much. Any questions about either of our subcommittee updates?
I wonder if like whatever we hear from the listening sessions would be helpful for your committee, because we're going to be talking a lot about like, you know, systems and resources and, you know, process and like how do we improve that, or what's kind of the sticking points, what are the barriers. So I think once we have all of that, that might be helpful to
I love
share
that
with
because we can provide all the amazing ideas that we think it will work best, but you know, we need the voices to tell us
who's actually doing it, who's
exactly.
accessing it,
Yeah, I agree with you. Yeah. So yeah, love that.
I just have a quick question on the recruitment for the lived experience. What has previously been done to advertise and what's going to change or will be updated for future
So we didn't do a lot of like public advertising about it. We mostly went through the Solutions Council members themselves and referrals through that. I think the next thing that I want to do is actually maybe talk to more case managers about folks who they might recommend.
I'll also just quickly add, we also went to, we host for all of our contracted service providers an executive roundtable where their leadership goes, so we went there as well to try to recruit.
Yeah, and we're open to ideas if there are places that you think we should be searching for, like putting feelers out.
Okay, good. That's great feedback, Vienna. And Zoe, thank you for thinking of that. So we will utilize those listening sessions and hopefully breed some goodness from that as well. Okay, our next agenda item is a presentation from Kisa around our Community Connect. So Kisa, I'm gonna give it over to you.
Actually, Chair, if it's all right, I have a quick walk-on item, just an update from what we brought forward last month related to the potential SHS reform measure. At that time, our Assistant Director Jess Larson was here to talk through the conversation to date and the interest of potentially using SHS resources to develop affordable housing. We were all on pins and needles waiting for Metro COO's recommendations. That is now out. So the Metro COO has released her recommendations. It's linked there, and then the materials and video from the Metro Council are also linked if you want to dive in deeper. I think the big headline for folks to be aware of is the idea of something on the November ballot is not a possibility. The idea of something in the May 2025 ballot is a possibility, and there's a number of reforms and action items Metro is interested in taking, rather Metro's leadership is recommending prior to anything going to the ballot. So we're in close conversation with Metro. It's up at the top of county leadership that are engaging with Metro leadership at this point. Again, there's 4 key recommendations. The last one is related to the measure, and there's certainly things within that, but Metro is also interested in indexing the tax. So essentially saying, we're going to index it to a certain dollar amount at a certain date, and then the cost of living adjustments or inflation will be taken into account. There's also interest from Metro leadership in renegotiating our intergovernmental agreements, which for those of you that followed SHS know that was a lengthy process. And in addition, there's interest in kind of other ways Metro can support reducing the cost of housing production. That won't necessarily impact the Homeless Services Division, but certainly something that leaders across the state are really interested in. And then the reforms that are under consideration, there was 10 sub-recommendations. I don't want to take the time necessarily today to walk through them, but I will offer, and I know some of you have taken me up on this, Jess and I or myself are happy to connect one-on-one and walk you through what's being considered. There's no action item for this body, but we want to make sure you're informed. And then the last piece, and I can work on getting this to Nadia so she can send it out, is the Washington County Board of Commissioners drafted a letter, and they approved of that letter Tuesday, to send to Metro councilors in response to the recommendation. So still very active conversation. It's slowed down, maybe even the hair smidge, and we're happy to kind of bring up regular updates to this space and connect offline one-on-one as well.
Did the county commission letter kind of support staff work that's going on in this, or are they taking a whole different position, or can you characterize that letter at all?
Yeah, it's in support of staff work and conversation and really uplifting the work that we've done to establish the homeless services system within the measure, or excuse me, within SHS resources, and then kind of saying, if there is going to be ongoing conversations, here's what we need to see taken into account. So the second half of the letter is really about the expectations that our Board of Commissioners has for Metro and how they engage. And I know Jess is not a panelist, but I do want to make sure if she's interested in jumping in, we make space for that as well. Her hand is raised. Oh, that's Jimmy.
Do we have an expectation around the next official action kind of thing. Is this going to Metro Council to vote, or is it just staying at the COO's level for a while, would we expect, or?
It is going back to Metro Council. I
Mhm.
believe it's either 25th or 29th. I'm forgetting the exact date, but they're going back to essentially of this month. And looks like, can we promote Jess to panelist? Is that a possibility? Jess, you should get a link to promote to panelist. Perfect. So she's popping back in.
Hi, all. Sorry for my, I've been here and Nicole, you did a great job presenting. So I just wanted to come off mute and say thank you and here to help answer any questions from the committee.
Jim, you looks like you have a question and could also sing us a song.
Yes, you probably don't want to hear that. I don't have a question. I just have a single comment. So as part of my thing on the Metro Council, I'm spending a lot of time with this report, and there is a lot in this report to consider. And Nicole did a very nice job giving a summary. The one thing that I would say is, in this long, extensive report, all of the illustrations are of successful Washington County projects. You are the poster child for this project. So there you go.
Thank you, Jim. Thank you, thank you. And thank you for being on that committee and diving into that so much. We really appreciate it. And thank you for that shout out. That is just such a true statement. It is Washington County doing such great work. Okay, so
Can I ask another question here?
You can ask as many as you'd like.
Yeah, thanks. Hey, Jim, given that you kind of lifted up Washington County, what is the other county kind of, the other two counties, how different are they in, as you look at the report? Are we fixing questions or problems from the other counties? Is that the majority of things that are in this? Or what's, you know, you've been spending time with it, tell me more.
Well, let me try to be as diplomatic as the person from Metro that I talked to yesterday. And she sort of gave agreement that a lot of this report deals with problems that do not involve Washington County. How about that?
I just wanted to hear it clearly. Thank you.
Perfect. Any other comments or questions? Okay, Kisa, I'm going to try this one more time, but we'll see if we can actually. So Kisa, if you're ready, we would love to get your presentation on the coordinated entry system.
Yes, it looks like I can't start screen sharing while another participant is sharing.
Oh, Kisa,
I have, yeah, we have the,
Oh, great. Okay, fantastic. That sounds good. I'm here to talk about coordinated entry. Wanted to give a brief introduction in case folks aren't familiar with coordinated entry. But the U.S. Department of Housing and Urban Development requires that areas running a continuum of care, COC, create a centralized or coordinated access system. So our goal of coordinated entry is to allow assistance to be allocated as efficiently as possible and that it be easily accessible no matter where or how people present. And coordinated entry helps us prioritize assistance based on vulnerability and severity of service needs to ensure that people who need assistance the most can receive it in a timely manner. Next slide, please. So there are a lot of qualities of an effective system. If you'd like to dive into the coordinated entry policy brief from HUD, it is linked here. But the three I like to highlight in this context are some of the requirements are that we have prioritization. So each community must develop a way to prioritize people experiencing the highest need for the limited resources available. That our housing opportunities and our coordinated entry system is low barrier and housing first. So we're not allowed to screen people out for perceived barriers like lack of income, substance use, criminal history. and that there's fair and equal access. So that means the system must have a variety of low barrier access points where people know they can go to access entry into the system. So phone lines, shelters, outreach worker, physical locations are all examples of outreach. And we'll talk about how those incorporate into our system here. Next slide, please. So coordinated entry is also designed to help build equity into systems. So Washington County contracts with a variety of community partners who complete phase one, our version of our intake assessment into the coordinated entry system. And that means people who may not typically access government resources may be more likely to be brought into our system. We can also evaluate how our prioritization model is working to ensure we see equity in who's coming into our system and who is exiting. And a big benefit is that participants don't have to rely on finding a case manager who knows a lot about housing in order to locate housing resources. Another kind of tangential benefit to this is coordinated entry prevents that cherry picking of participants who may be perceived as being more successful in housing programs than other participants. So it's really encouraging serving a broad spectrum of participants who may be at various stages of their housing readiness journey. Next slide. So in Washington County, so just as Kleenex is a brand name for tissues, Community Connect is the name for our coordinated entry system. There's kind of two pieces of the coordinated entry system here in Washington County: Community Action, who organizes the day-to-day operations, like staffing the phone line, completing those phase one intake assessments, matching people to the housing and shelter resources, doing that side. And then Washington County, who's managing the policies. We're contracting with the service providers to become access points for phase one assessments, and then coordinating with our housing and shelter programs to make sure that we're meeting their referral needs. Next slide. So this is a very high level overview of what it looks like for a participant, but the idea is they visit that access point. They're working with a staff member who's identifying that instability. Staff are completing a phase one assessment for eligible participants. They're entering that data into our homeless management information system, HMIS. All those lists of all those folks who have completed assessments are prioritized, and then our top prioritized participants are matched to a variety of different housing resources. A lot of acronyms on there, but we'll talk about that later. So who is eligible? Folks who have an income under 50% of our area median income. Folks must be experiencing literal homelessness, be at risk of homelessness in the next 30 days, or fleeing domestic violence, and have a strong tie to Washington County. A strong tie to Washington County can include having a job here, having kids in school here, previously living in Washington County and being displaced due to economic reasons, but really wanting to come back to Washington County because that's where folks' ties are, but having some sort of tie or connection to Washington County. And folks can get an assessment by calling Community Connect, the phone line, or walking in to their access points. They can meet with one of our contracted housing or shelter providers. All of our outreach workers who are going out in the community to meet with folks who are experiencing unsheltered homelessness, they can all do assessments. We have contracted culturally specific providers who can do those assessments. And then we have assessors who are embedded in our healthcare and justice systems, which is really exciting, and I think been an amazing opportunity to get folks into our system who might not typically be identified. Next slide, please. So assessments, as I mentioned, our coordinated entry intake assessment is called the phase one assessment. All the questions asked on the assessment are required by a funder or used to match participants to housing or shelter programs. So we're not just asking questions for fun, they all have an intention. And questions on housing history, length of time homeless, and disabling condition are used to assess for chronic homelessness, which is used in prioritization. Next slide. So prioritization. Washington County prioritizes services first to households who are experiencing chronic homelessness as defined by HUD. I don't have the link in this presentation, but if you Google HUD chronic homelessness flowchart, you'll get a really great flowchart of what HUD chronic homelessness means, but it's basically folks who have a disabling condition and are have experienced many episodes, frequent episodes of homelessness in the last 3 years, or had a prolonged episode of homelessness in the last 3 years. All the households who are experiencing chronic homelessness are sorted into 4 population groups. We have families, transitioned aged youth, that's youth between 18 and 24, adults over 55, and then all other single adults. And then each of those populations is prioritized by length of time homeless. Next slide, please. So referral. After participants who have completed the phase 1 assessment are prioritized, participants who are most highly prioritized are matched to housing and shelter resources as available. Community Connect facilitates those referrals, and we use case conferencing spaces to increase provider collaboration around hard to locate participants, and we've started matching participants to housing resources in case conferencing as a way to help kind of speed up that point between connection and identification and connection. So, little brief overview of case conferencing. Right now we have 3 different case conferencing spaces, a couple others that are newer, but I'll focus on these 3. We have Community Connect case conferencing. So that's our twice a month case conferencing space where we have our housing providers, outreach, shelter staff, anybody who's a phase 1 assessor is welcome. We meet twice a month to review those different prioritized groups who are waiting for housing or are matched to housing but have not yet been enrolled. We're doing matching to housing, we're doing problem solving, we're doing connection to like other providers, making sure that folks know who's all working with one participant, all with the goal to reduce that length of time between identification and enrollment. We also have the local command center LC3 case conferencing. Those are weekly case conferencings for street outreach teams with the goal of locating and engaging participants living outside to help them access shelter and housing resources and connect them with resources to address immediate needs. We also have healthcare case conferencing. That's a twice a month meeting between healthcare providers, housing case managers, outreach workers, and it's really about collaborating to support participants in accessing health-related services and learning more about what resources the healthcare side can provide to support participants as they navigate their housing journey. And I think that's the final slide. So I am happy to answer any questions folks have. I know you have an exciting site tour today as well, so I don't want to take too much time, but happy to answer any questions. Yeah, James.
2 questions. One is, this is extremely important. Is there data available for people coming into the system? And if so, can we see it?
Yeah, can you tell me more about what kind of data you would like
Sure.
to see? Or
Sure. I think it's a predictive variable for where we're going in this process. The number of people coming in and accessing the system and who they are, I think would give us a predictive idea on where things are going. So it seems like you have that data. Be nice to see it, and it would be nice to see it for all the other counties also.
Sure, some of that data is in our annual report. So the annual report for the last fiscal year is available, and they'll be working on the annual report for this most recent fiscal year very soon. So we will have some of that data available soon.
Yeah, from my point of view, it would be more valuable to see that on a more frequent basis, to know where you're going, during the year, just to see where demand is, who's coming in, and what the demand is, and how it's looking. I think that would be really helpful.
I'm gonna agree with Jim. I would love to see how long, when someone is connected, and then how long are they waiting to be then referred to said priority or program. I mean, because I think what we're experiencing, so Jim, your point is really well taken, is some of the friends that we serve just keep getting bumped because somebody with quote unquote priority comes into play. So then they're sitting in a queue for a very long time.
Agreed.
Yeah, I absolutely hear you, and we'll, I'll bring the data request back to our team. I know some of that data is available. It's, you know, making sure that we have it in a publishable way. That's the piece that we need. So I can definitely bring that back to the data side.
Yeah, I would really like that. I have a second question. And my second question regards the attachment to Multnomah County, I mean, to Multnomah, excuse me for misspeaking, to Washington County. Is this a HUD required or is this a local requirement? And my question is really, isn't this a regional system and aren't people able to access the system no matter where they come from? So thank you.
Oh, yeah, that is a great question. So HUD requires places with a continuum of care to have a coordinated entry system. So all places across the US with a coordinated continuum of care funds have some kind of coordinated entry system. They all look a little bit different. Locally, I believe that we have elected to use a coordinated entry system to match people to SHS funded resources as well. So the other counties do have their own coordinated entry systems. Right now, they're not regionalized in that way. So if someone is in Clackamas County, but they also have strong ties to Washington County, they would need to enter Clackamas County and Washington County's coordinated entry system separately. That is one of the points that we are talking about in the Metro work group subcommittee that I'm part of on how we can regionally align pieces of our coordinated entry system and how we could better support participants who are connected in multiple counties. So it's work that is being investigated and being done.
Great, thank you.
And Kisa, can I ask a quick follow-up question just to make sure I'm fully clear? My understanding that the tie to Washington County could be as simple as someone that wants to live and reside in Washington County. Am I correct?
We have historically made it a little bit stronger, the need for just a slightly stronger tie. So having supportive services here or, you know, again, having employment here or children in the school system in Washington County, having some kind of support services that folks are accessing, whether it's, you know, I camp here frequently and I go to the PHC Day Center when I'm here, or it's, you know, accessing shelter or outreach services. So some kind of connection to Washington County beyond a desire to live here is one of the requirements for completing an assessment.
Any other questions for Kisa? Okay, Kisa, thank you so much for coming and explaining this to us, and we look forward to the follow-up to some of our questions.
Absolutely, thank you all, take care.
Okay, the next thing on our agenda item is a quick discussion about listening sessions. And in a second, BNF is going to give us an update about those. But this is one of those opportunities for us to really show up. We have canceled our regular scheduled Solutions Council meeting so that we hopefully can make time for these other two meetings. The first one being August 7th during the Histon meeting. So in the morning, and that is virtual. And then the second one is August 19th. It's a Monday and it's in the evening at the Beaverton City Library. But BNF, if you want to update us, we would love that.
Not even well, the main thing that I would add is that we'll be sending out flyers and registration links and things like that you can all share with your networks. And then if there are any questions that come up, just refer them to me.
Yeah, and I would also add, with Nadia saying, if you'll be attending as part of the Solutions Council, if you can let Nadia know, just so we can tap you into breakout room facilitation support. we're just looking for some light support with that, so would love volunteers. And we'll prepare you and all of that, so no need to stress about that, but if you can let Nadia know, that'd be great.
And I'll also add, so the virtual one with providers will have those virtual breakout rooms, and the in-person meeting will have tables for folks, and there will be a staff person as well at the table with you, so you wouldn't be on your own. But we'd love to have your help facilitating and getting feedback from the community.
The groups will also have staff. And just one other reminder that like a big part of the listening sessions is to introduce all of you, and some of you were not here, but like to the public and to our provider network. And so so it's really important that, you know, everyone try their best to show up for at least one session. I will also, in my like post-meeting email, I'll follow up with everyone about attending the listening sessions.
Thanks, Ken.
Awesome. So as we get closer to those, we'll continue to check in, or Nadia will probably continue to check in and make sure anybody that is participating, if you're willing to be part of those breakout sessions, virtually and in person, we would really love your support in that. I believe I read that we went ahead and canceled the site visit today for multiple reasons.
Laughing. I was like, why are they laughing?
Because it's gonna be so fun. Oh, we're not going.
Yeah, I thought that, I mean, yeah, it seemed best to reschedule that or revisit that idea. And so we were just wondering if there is enough interest, and I will also, in my email, ask the folks who weren't here, whether there is interest in doing things like site visits or other field trips. Is Boys and Girls Aid like on that list? Is it still of interest? And then we should just figure out rescheduling it. Are there other places that people want us to look into organizing other trips? So yeah, that was our just general question.
I think it's a great idea, even though it didn't work today. I think we've proven July is just a rough month. And I think Nicole said it the other day, most of the other councils don't even meet in July. So, but I do think it's a great idea to do tours and get to know some of the partner agencies that the Solution Council is a part of. So I'm still game. It just didn't work as well for today.
Yeah, same.
Yep.
I agree.
And this way Drew can be there.
Yeah.
Okay, was there anything else on the agenda or for the good of the order that we needed to discuss?
Just following up from the last meeting, who's the person on point for the housing forum? I know it's not like active right this second. Oh, hello. Very good. Thank you.
Yeah, we're excited. Yeah, we'll probably be more information.
November. It's
Yeah.
not right now.
Yeah. We're very much at the beginning of planning.
Okay.
But y'all's comments have been great and we appreciate it. And now it's just the job of the planning team to take all of that and put it in action. So we're excited. We'll probably come back in the fall for updates if we have them.
Great. Anything else? Anybody online or in person? Not hearing anything, then we will go ahead and adjourn this meeting. So this was the July Solutions Council. Thank you for being here.
Thank you, Kim.
There.
Thank you, Kim.
Thank you guys. Have a great day.